Okay, welcome everyone. Thank you for joining us online to launch the new book published by the ANU Indonesia project entitled Economic Dimensions of COVID-19 in Indonesia, Responding to the Crisis. Today's book launch event is co-hosted by the ANU and the Lowy Institute. My name is Roland Rajah and I'm the lead economist at the Lowy Institute and have the pleasure of chairing today's session. As the ANU and Lowy Institute are both based in Australia, I'd like to begin by acknowledging the traditional custodians of the land in which we meet and pay my respect to elders past, present, and future. COVID-19 is the largest shock to hit the Indonesian economy since the 97-98 crisis, and the pandemic is still ongoing, with the path to normality and recovery still extremely uncertain and still not clearly within reach. This book is the first comprehensive analysis of Indonesia's initial experience and response to the crisis from an economic perspective. It collects papers from a conference of the same name organized by the ANU in September last year and is edited by Blaine Lewis and Firman Witoelar of the ANU Indonesia project. On behalf of the editors and the Indonesia project, let me also take a moment to thank all those that contributed to the book, including various chapter authors, the copy editor Tracy Harwood, all those who participated and supported the conference last year, as well as the Australian Department of Foreign Affairs and Trade for its generous financial support to the ANU Indonesia project. This book covers the full breadth of issues, from the role of fiscal and monetary policy to the health, social, and poverty implications of the crisis. Throughout the chapters in the book, the focus is on both diagnosing the issues and guiding the policy response. Later today, I will share a conversation with several of the authors of various chapters, and the members of the audience will also have the opportunity to ask their questions. But first, we have the very special privilege of being able to hear from the Indonesian Vice Minister of Health, His Excellency Dr. Dante Saxono Habowono. The Vice Minister is a specialist in internal medicine and has a PhD in molecular diabetes from the University of Yamanashi, Japan. He is also a member of the presidential team of physicians and has been Indonesia's Vice Minister of Health since December 2020. Vice Minister, welcome, and I invite you to make your opening remarks to officially launch the book.
Yeah. Thank you, Mr. Ronald. The Excellency Mr. Ronald Rajah, the chair of the launch book, the authors Firman Witoelar, Australian National University, Sharon Bessell, Australian National University, Stephen Grenville, Lowy Institute, Sydney, Masyita Crystallin, Specialist Advisor to the Ministry of Finance, and distinguished guests, and ladies and gentlemen, good afternoon. Good afternoon, all of you. It is with a great honor to having you all here today to launch the book of Economic Dimension of COVID-19 in Indonesia, Responding to the Crisis. As we might aware, Indonesia and Australia have signed the Memorandum of Understanding on Health Cooperation on 13 November 1992. This MOU is the one of the process supersede to adapt the Florence of Health Development implementing the MOU. I believe this forum is one of the program accelerated the implementation of the supersedes MOU. Excellency, ladies and gentlemen, the MOU is developed and officiated to show the both countries committed in strengthening our mutual collaboration toward a betterment of health status in both countries, as well as to contribute improvement of health status at large. We pinch out the MOU between Indonesia and Australia can also support the cooperation COVID-19 strategy. Thus, in early February 2021, the Minister of Health of Republic Indonesia and the Ambassador of Australia have discussed and the cooperation between Indonesia and Australia in the health sector, particularly in the prevention and control of COVID-19, such as developing hospital network to share COVID-19 therapeutic experience, developing COVID genomic sequencing laboratory network, and increasing the range of testing, tracing, and isolation. They are in the line with the objective of this forum, which is to provide information as well as facilitate discussion to analyze the economic aspect of Indonesia's response to the COVID-19 pandemic, the macro and microeconomic effect, and the short-term as long long-term impact of COVID-19 pandemic. Excellency, ladies and gentlemen, President Joko Widodo has given mandate to Minister of Health to gain better health strategy in response and control COVID-19 pandemic in Indonesia. It is pertinent for me to work together with the Minister to fulfill this important task. Since early 2020, COVID-19 pandemic has been a crucial issue facing by every country in the world. Indonesia is the fourth largest country in the world with around 2,000 to 270 million people has also faced COVID-19 pandemic comprehensive impact. However, modern information and communication technology are revolutioning and have a great potential to help address contemporary global health problems. Information and communication technologies have great potential to address some of the health challenges faced by world countries, either providing accessible, cost-effective, high-quality health care services. Telemedicine use information and communication technology to overcome social restriction, geographical barrier, and increasing access to health care services. This particularly beneficial strategy for handling COVID-19 pandemic, also for rural and underserved community in developing country, group that traditionally suffer from lack to access the health care. The importance of technology and digitalization of healthcare system that has highlighted by COVID-19 pandemic, also in the line with Indonesian effort to combating the industry 4.0 era, in which Indonesia has designed marking Indonesia 4.0 as integrated roadmap to implementing the number strategies. The Minister of Health of Republic Indonesia has progressed the information to digital health, including through telemedicine, improving performance, effectiveness, efficiency to healthcare service for all Indonesian people. Excellency, ladies and gentlemen, one of the Indonesian government strategy is using information communication technology to overcome health service challenge. In this regard, the Minister of Health has issued decree number 20 years 2019 regard implementing of telemedicine service between health service facility. Through the decree, concept in the developing telemedicine regulation and telemedicine platform are data protection, patient safety, standard of health facility, e-pharmacies, personal data access, and e-medicine record. I'm on the view the health service challenge can overcome health problem through the e-health, also overcome economic burden, given benefit for the government and society in handling controlling infectious disease and also non-infectious disease. Excellency and ladies and gentlemen, to conclude my remark, as the next G20 presidency 2022, Indonesia commit to explore the possibilities of discussing the health digitalization, value-based healthcare, and the aspect related to global preparedness and response during our chairmanships. The current health system faces major challenges due to the increased demand for the health services, with leading to increased financial burden of healthcare. Building the health system that ensure the sustainability and efficiency of health service delivery is imperative, with priorities among other the preventive and promotive measurements. Value-based healthcare can be a solution in this regard, and this concept is still less common. We need to facilitate sharing best practice and lesson learning from the implementation of this approach. In closing, I hope the message from Indonesia government delivery today will be useful to encourage more attractive and concrete collaboration with you, all of you, toward a better health strategy response and control COVID-19 pandemic in Indonesia. Thank you so much.
Thank you very much, Vice Minister, for those remarks and for officially launching the book. Now, if we may, we have two questions from some of our experts here today. One from Firman, Witoelar, and another from Sharon, Bessell, both of the ANU. Firman, if you would like to please ask a question.
Thank you, Roland. Mr. Vice Minister, thank you so much for your remarks and for giving the opportunity for us to ask a few short questions. So one of the heaviest criticism to the government responses to the pandemic in the past year has been on risk communications, the mixed messages between strict health protocols and mobility restriction on one hand, and encouraging travel on the other hand. So what do you think has been the most significant changes on these issues since December 2020? Thank you.
Yes, it's important to make the health protocol for the people around and to get the policy that behind that. So we try to complementary and to make a balance between the economic and health services and health protocol. But we try also make the protocol of health is most important thing that if you want to end this pandemic. But if sometime we can see the health protocol and the other policy will contradictive, actually we try to make this pandemic will be end as soon as possible, and the health protocol is the priority that we make to cover this pandemic.
Thank you, Vice Minister. And Sharon, would you like to ask your question?
Sure, thanks, Roland. Vice Minister, thank you so much for your time today and being prepared to answer these questions. And thank you more broadly for the efforts of you and your colleagues in managing COVID-19 in this most difficult of times. Prior to COVID-19, some colleagues and I undertook a study of multidimensional poverty in South Sulawesi, and I'd like to acknowledge our partners and colleagues at Unhas and SurveyMeter in that work. And that demonstrated the particular vulnerability of people living with disability. I wonder if I could ask your thoughts on how people with disability, particularly those already living in poverty, can be supported during this time of pandemic. And if I may, a second question, to ask your thoughts on a problem that has emerged in countries around the world, including Indonesia, based on the somewhat limited evidence that we have available. And that problem is violence against women, particularly domestic violence. This, of course, has very significant health and social implications. And any thoughts you have on how this problem can be addressed would be greatly valued. Thank you so much.
Yes, thank you for the question. There's a priority. We can have a 3M, 3M aggressive policy, and 3T, tracing, treatment, and testing for the one of the, in the other hand, for the policy to cover all the people can help. And not only, this problem is not exclusive for the government action, but also should be handled with all of the people in Indonesia and also all the people in the world. Because in one pandemic, we can working together and we can make together to crossing this pandemic. Sometimes it's difficult to make the people that already 1 year exhausted with this pandemic. In the other hand, we should have facing with this pandemic that we can never know when we will stop this pandemic will ending. So that's why we try to accelerate some program to make the people to be obey with this protocol and try to make the people and not only and also the government in the local area to always protecting those people to make all facility can happen. We prepare in every vacation times, like in holiday vacation time, like in New Year Eve. Last time the case will be increased. We will also the Eid Mubarak vacation also based on next will be come next week. We also try to make this cases will not increase to promoting more and more the protocol of health should be one of the most very clear to deliver it to all the people in Indonesia. That's my question.
Thank you, Vice Minister, for those answers to those questions and also for your remarks. We're about to move on, I suppose, to the panel discussion component of the launch event. I understand you won't necessarily be able to stay for the entire event, Vice Minister, so let me just take the opportunity now to thank you for your time, for officially launching the book, for answering the questions, but also to wish you best of luck with your important work in managing the pandemic in Indonesia.
Thank you. Thank you for all.
Thank you, Vice Minister.
Bye.
Okay, we now can move on to the panel discussion portion of today's session. So let me begin by just introducing our five panelists. So first we have Firman, Witoelar, who is a fellow at the ANU Indonesia project and one of the editors of the book. Prior to joining the Indonesia project, he was research director at SurveyMeter and was involved with the development and implementation of the last two rounds of the Indonesia Family Life Survey. Next, we have Masyita Crystallin, who is special advisor for macroeconomics and fiscal policy to the Minister of Finance. She is also a senior researcher at the Demographic Institute at Universitas Indonesia and was previously the chief economist for DBS Indonesia. Stephen Grenville is non-resident fellow at the Lowy Institute and was previously the Deputy Governor of the Reserve Bank of Australia and a member of the bank's board, and has a long history of engagement with economic policy making in Indonesia. And Sharon Bessell is Professor of Public Policy at the Australian National University. She is Director of Gender Equity and Diversity at the Crawford School of Public Policy, where she heads the Children's Policy Centre and the Poverty and Inequality Research Centre. And finally, Pandu Harimurti, who is joining the panel as a discussant. He is Senior Health Specialist at the World Bank, where he has worked for more than 16 years on topics including health financing, health system strengthening, communicable diseases, and tobacco control. So let me welcome all of the panelists to today's event. Now, just very quickly, before we start the discussion, just a quick note to the audience that there will be time for questions and answers after the panel discussion, and that you can submit a question via the Q&A box at any time, or simply use the raise hand function when we get to the Q&A part of the event. So to kick things off, let me start with you, Ibu Masyita. In your chapter, you focus on the role of fiscal policy in responding to the crisis. So could you please start off our discussion by giving us a bit of an overview of the government's fiscal response so far, and also your assessment of how effective it has been?
Thanks, Roland. So the fiscal policy has reacted basically with three basic priorities. First is, of course, health, to fix the pandemic. And second is to fix or to expand the social security. And then the third one is supporting the business sectors, especially the small, medium enterprise and informal sectors that are hit hard by the crisis. So if you're looking at an impact of a certain policy, it's a long story, right? Because the economic is rebound now. One might say it's because of the global mobility or the mobility of people has increased, or it's because the economy already get back together. So it's not because of certain policy. But when you look at the variables, the COVID currently in the world is at escalating mode, right? And in fact, it has reached the peak higher than the previous one. And in Indonesia, if you look at the COVID number, it has decelerated. Of course, not as fast as we expect, but the trend is different from the world. And if you look at by number, of course, it's supposed to be by proportion, but if by number, the number of vaccinated people in Indonesia reached number 9 in the world. So from the COVID, pandemic measures, Indonesia, you can say, I don't want to say successful, but it's above average in the world. Yeah. This has created more confidence in the market. So if you look at in the first quarter of this year, and in fact, including this month, the high frequency indicators of consumer and then investment showing that people confidence because we have controlled the pandemic better is improving. So you can see that on one hand, the economy is getting back on speed, but at the same time, when you talk about fiscal, of course, it's not only the short-run issues, but on fiscal strategy. In this, we also talk about, financing. Indonesia has debt monetization with Bank Indonesia last year. And then we also talk about, when we talk about global investors, then you do care about ratings because it will affect the financing costs for further fiscal expansion, for example. That's also in 2020 or 2021. So far, we have maintained the ratings of Indonesia in the midst of rating downgrades globally. So you can say that in terms of fiscal, it has managed the crisis quite well, while at the same time trying to maintain fiscal sustainability. On top of that, we are in the middle of reform. So with the Undang-Undang Cipta Kerja, the Omnibus Law, and currently we're working on Omnibus Law on financial sector, we're also continuing reform and using this crisis, this pandemic event, as a boost to do more on the reform. From the fiscal side, of course, there's several reforms, but from the infrastructure point of view, increasing value added or productivity, increasing human capital, and all of this are continuing to be implemented, despite the current pandemic situation.
Thank you, Masyita. We might come back to some of those forward-looking issues later on in the discussion. Steve, let me turn to you. Your chapter, which we co-wrote together, focuses on monetary policy. And of course, in the current crisis, the line between monetary and fiscal policy has become significantly blurred. It's true around the world, but Indonesia, quite notable among emerging economies in leaning quite heavily on Bank Indonesia to help fund the budget deficit. So can I just ask you to just share some of your thoughts on the approach the government and Bank Indonesia have taken so far, and particularly around the so-called burden sharing agreement? What do you make of this?
Well, thanks, Roland. It's a pleasure and a privilege to be here. This was a major challenge for Indonesia, and Roland and I wrote about the macro challenge. I think Indonesia has done extraordinarily well. Of course, it's so far so good. If the health situation deteriorated, then the economy gets a greater challenge. But so far, the macro has done extraordinarily well. Inflation is actually below the target. The exchange rate is in good shape. The current account is in good shape. All of that's gone well, and there's been very good cooperation, as far as an outsider can tell, between Bank Indonesia and Lapangan, the Ministry of Finance. So this is really a terrific performance. There are always dangers to this. I think the greatest danger was that the fiscal expansion, which Bank Indonesia helped, and which was absolutely central to responding to the crisis, could lead to some structural changes which are not in the best interests. Once Bank Indonesia had started funding the budget deficit, then, of course, there were cries for, why don't they go on doing this forever? Now, Bank Indonesia has handled this very well. They've kept a very low profile. They haven't taken on these people who are wanting them to commit to doing things in the longer run. They have simply let the existing COVID-oriented help for the budget, letting that continue. And I think this low profile has worked well for Bank Indonesia, because Bank Indonesia, the recent history would remind them that you can have independence. Independence can be given, but independence can also be taken away. This, I think, was maybe one of the great dangers. And if there's a moment later, I'll talk about the exit strategy from what has so far been an extremely successful macro response.
Thank you, Steve. Now we might switch to more the microeconomic side of things and the health and social side of the crisis. So, Pak Firman, in your chapter, you focus on the impact of COVID-19 on non-communicable diseases, or NCDs. So can you tell us, how do you see the relationship between COVID and NCDs, and how big of an impact do you think the pandemic will have on the challenge of NCDs in Indonesia?
Thank you, Roland. We actually learned about the relationship between NCDs and COVID-19 pretty early. I think even around mid-year last year, we know that there are some parts of population that are more susceptible to be infected with COVID, and when infected, to have higher risk of becoming severely ill or dying. And these are older people and those living with NCDs and conditions including hypertension and obesity. So that much we learned at the time we were writing the paper, and it's pretty much established now. And that's the most direct link. But we also know that knew that in the early months of the pandemic, there have been major disruptions to ongoing NCD services in most countries, including Indonesia. And in Indonesia, for example, hospitals, puskesmas, posyandu, for a while stopped providing essential health services, and people are stopped going because both mobility restriction and also because of fear of getting infected. And these disruptions can have impacts on the progression on existing NCDs. And thirdly, although our understanding about COVID is still evolving, there have been some evidence of long-lasting health impacts of being infected with COVID, even if one survives. And this impact potentially add to the prevalence of NCDs in the future. And again, but those are the most direct links, and there are other links that work to other channels that we discuss in the book, including loss of livelihood from loss of insurance, access to better quality nutrition, and so forth. But what really motivated us, Mira, my co-author, and I to write the chapter was we knew from our previous work that even before the pandemic, NCDs have become the major contributor of health loss in Indonesia, and measured by how much healthy life is lost due to illness, to disability, or to early death. And in the last 20 years, the loss that comes from NCD have doubled, and replacing the communicable diseases. And because NCD progress slowly but have long duration throughout someone's life, so it increased use of health services, expenses throughout the life during the productive age, and so the economic cost is enormous. And we also knew that NCD constituted the largest case-based payment in BPJS. So, and these are all problems that we faced even before the pandemic. So we built on those and discussed the possible channels that through which this pandemic has worsened the health and economic outcomes, and how it may threaten the the existing inequities. But to really quantify how much an impact this pandemic will have on the challenge of NCDs, it's really challenging because all of these different channels, and it may be sometimes before we know the real cost, but it is a necessary task.
Thank you, Pak Firman, and we'll come back later in the discussion, hopefully, to how can the damage that's been done be reversed, hopefully, and managed going forward. Professor Sharon, just turning to your chapter, your chapter focuses on multidimensional poverty, and of course, the usual thing is that the focus tends to be on the impact on narrower income-based concepts of poverty. So just to kick off on this area, can can you tell us, why is it important to take a multi-dimensional approach when thinking about these issues? And, what's the risk of, what do we miss? What do policymakers risk missing if they don't think of things in terms of multi-dimensional poverty instead of the narrower income-based measures?
Thanks, Roland. I think the first thing that I would say is that income is and always will be essential to our understanding of poverty and to people's experiences of poverty. And certainly in the context of COVID-19, those dramatic declines in incomes for some groups have exacerbated poverty greatly. And so in talking about multidimensional poverty, I think it's very important that we keep at the forefront of our minds that income is one of the essential dimensions of poverty. I think there are other dimensions of poverty that are important, particularly in the context of COVID-19. And one of those dimensions is around the social and the relational nature of poverty and the way in which poverty can either be exacerbated or mitigated depending on the social connections that one has. And in the context of COVID-19, that becomes acutely important because what we see in some cases is a consequence of social distancing and isolation, being that those social connections and those supports are being broken down. Of course, the flip side of that is if we don't have people social isolating and distancing themselves, then we're likely to see far more rapid spread of the virus, and we've seen that in places. So we have a real dilemma, I think, in the context of COVID-19 in terms of how we ensure that those social connections and social inclusion that is so important in terms of managing multidimensional poverty and ensuring that people are able to engage in that mutual support that's so critical, while also ensuring that we don't have the spread of the virus. I'd say alongside thinking about multidimensional poverty and the relational and the social dimensions of poverty that are so important, it's also to think about intersectionality and the way in which multidimensional poverty impacts on particular groups depending on their social characteristics. And so we know from a lot of pre-COVID analysis that poverty impacts on women and men differently, that it impacts on people with a disability or people living in particular geographic locations differently. And once we get the intersections of those social characteristics, we start to see real vulnerabilities emerging. And so in the context of COVID, for example, women with disability living in rural areas are likely to be particularly vulnerable to increased poverty. And so we need to think about the multidimensionality of poverty, but also and how those dimensions overlap to deepen people's experience of poverty, and also to think about intersectionality in order to understand which groups are most vulnerable and how we need to respond.
Thank you, Sharon. Really encapsulates and shows how complex the ideas of poverty are, but also, as you say, measures to manage the spread of COVID, undermine social connection and therefore create their own kind of damage. Makes it very difficult, I'm sure, to address, which we'll hopefully come back to later in a moment. Pandu, I'd just like to turn to you now as a discussant, as someone who's wasn't one of the contributors to the book, and therefore perhaps not a vested interest in the book. I'd like to maybe just ask you to share your thoughts on what you think, having looked over the book, what the contribution of this book is and will be to the Indonesian policy debate, particularly given your own views about how effective the government policy response has been and what you think the priorities need to be going forward.
Okay, thank you very much, Roland, and it's a pleasure to be a part of this panel, and also it's a pleasure also to have the opportunity to read the whole book. I think I can say that what is interesting, and also not only interesting, but the benefit that we can have from this book is that it is so timely. usually academia or research center will need some time to come up with evidence, but this is something that can be pulled out in a short time and provide comprehensive evidence on the impact of COVID to multi-dimension of development. So this is an important piece of work that could contribute to the policy. But specifically, because I'm coming from the health sector, I'm looking at the elements of the health that each subject of the book is looking at. Yeah. All are pointing out the multi-sectorality and also revealing the existing weaknesses of the system, and also each topic also provides areas for improvement and also practical policy recommendations. So this book provides a comprehensive review of the system and also provides what is called proposed actions. In terms of government response, I think the pandemic reveals the existing weaknesses of the system. Not only health service delivery system, but also health security preparedness of the country. And the pandemic also further stretched the capacity of health service delivery, not only specifically for COVID cases, but also for non-COVID essential health services. I think Firman chapter has highlighted the existing issues of the health system in responding to the one of the health priority areas that tend to be overlooked, which is the growing NCD. So I think because there are so many elements or pillar or subsystem within the health system that needs to be improved. Looking forward, also we need to pay attention to what is the global economic situation will have impact on health financing, because the availability of the resources will be key to finance the much needed reform or to address the weaknesses that are what is called brought to surface by this pandemic, right? So there's a challenge in using the potentially shrinking available resources for health. The need for the government to prioritize what element of service that are needed. But also, if we look at how the pandemic, one example is that how the pandemic changed the health-seeking behavior, and how the system is not prepared to respond to that. I think one element, one innovative intervention that the Vice Minister brought up was telemedicine. But the issue is that whether the enabling factors, the enabling environment that enables the use of telemedicine is already there, is already available. A simple example is that the use of teleconsultation is not yet reimbursable by the social health insurance, and that will prevent the use of the telemedicine. So these kind of issues need to be addressed, and I think the book has brought up the weaknesses of the system and brought up to the attention of the stakeholders. So I will stop there and hand it over back to you. Thank you.
Thank you, Pandu. I'd like to turn our discussion now away from the diagnosis of the issues, which I think we've covered now, towards what needs to be done, particularly going forward, and to some extent this might go a little bit beyond what was only contained in the book. So let me begin with you, Sharon, just around the issue, of course, around social protection. A key part, as we heard from you, Masyita, key part of the government's response to COVID-19. So how can the government realistically strengthen the existing social protection system, both, obviously in a general sense, in a medium-term sense, but also in particular, of course, in response to the pandemic? How can it make a difference, while the government and households and people are dealing with the pandemic? Share your thoughts, please.
Thanks, Roland. I guess I'd preface these comments by saying there are people in this webinar who are working on these issues on the ground, and so I would always defer to the experience that they're having on a day-to-day basis, and also that governments are in a phenomenally difficult situation here. This is unprecedented in terms of how we deal with the challenges that we're facing in Indonesia and elsewhere. Make a couple of points. There's been some really interesting modelling done by UNICEF with the Ministry of Finance that's modelled how child poverty and vulnerability has increased, and we have seen an increase in child poverty, as we would expect, as a result of COVID-19. But that modelling also suggests that these emergency support packages have helped to a considerable extent, and the child-focused conditions within PKH particularly have been important in supporting children, but vulnerability remains very high. I think there are a couple of challenges that we face. One is around the targeting and how we identify who's in need. And what is less clear is what the impact of poverty and vulnerability is on children whose families are part of the new poor and are not eligible for emergency support. And so I think that's a real challenge that needs to be considered, and how effective targeting can be in a context such as this, where poverty and vulnerability are moving so quickly. But we do certainly see from that modelling from other research that, as in many countries, as those emergency support measures are wound back, we're likely to see a very negative impact on the poverty of some households and of children within those households. In terms of what we need to do around social protection, I think we also know, given the patterns of poverty prior to COVID-19 and then across 2020, that female-headed households and those households where women are main breadwinners are likely to be particularly negatively impacted. We saw, the immediate impact during the crisis, during COVID, the early months of COVID, on small businesses that are run by women, and those being disproportionately impacted. And so I think what we're seeing in Indonesia, as in many other countries, is pre-existing inequalities, particularly gender inequalities, being exacerbated. So in terms of social safety nets, ensuring that female-headed households and businesses that are small businesses that are operated by women are well supported is really crucial. I think the other thing that I would just say is some interesting and important work that's emerging that's highlighting food insecurity, particularly in rural areas, as some people have coped with the pandemic by returning to their villages. What we found in our study prior to COVID-19 was the deep food insecurity in many rural areas, and particularly in more remote areas. So I think we need particularly to think about how food insecurity can be addressed in those remote and rural areas, particularly where we're seeing large numbers of people returning from cities to villages, and food insecurity likely increasing in those areas. But I think we don't yet have enough sufficient evidence around that, and that's something that we need to know. And of course, food insecurity in Indonesia has long had really negative impacts on child development, particularly around child stunting. And so I think those issues of food insecurity are a really critical part that need to be considered within social safety nets.
Thank you, Sharon. Can I just ask you a quick follow-up question? I mean, in terms of getting more immediate support out there, in terms of also from a more macro perspective, giving stimulus to the economy, do you think it's a good, viable option and simply be to try and ramp up the existing systems, or would some sort of more universal transfer be the way to go to capture the new poor? Just your sort of quick thoughts on. Sure.
I think given the data that are available and the challenges that we know have been there around targeting prior to COVID, targeting is really problematic. Targeting is difficult. That's become so much more difficult in a context where poverty is moving so quickly. There are certainly debates about whether financial assistance or support should be targeted to the kind of the upper decile of the population, but certainly it's more than the bottom 40% that are vulnerable as a result of COVID. And so a more universal approach, I think, is certainly something that should be considered.
Thank you, Sharon. Firman, just coming now back to NCDs, you spoke earlier about the very large economic costs and the very long-term damage that's being done almost as a kind of side effect as COVID interacts with these other issues. So, what are your thoughts, ideas about what needs to be done to reverse this or at least manage that damage going forward?
Right. I mean, there are a number of laundry lists that have been suggested on how our health system should respond or to reverse the damage done the pandemic. And a lot have been said about the need to build better, about how the pandemic, by highlighting the burden of NCD challenges on our health resources, would hopefully lead to better trajectory. But at the same time, we know that the pandemic has not only derailed the trajectory of NCDs management, but also on other health outcomes, including, for example, that what Pandu mentioned earlier in reducing stunting. And so any sort of suggestions or policy recommendation will likely entail very difficult trade-offs. And if you look at it, in the past few years, Indonesia has finally been making some progress on the stunting front, on reducing stunting. And it looks to be the result of putting together resources to attack the problem all at once, or multi-sectoral approach that Pandu mentioned as well, and addressing the issue of care, food security, and health environment at the same time. And also building on the strength of community-based health services such as the Puskesmas and its network. And one of the lessons learned from that, it looks like what works for those programs may also work for NCDs. And thinking about the same approach, building on the strengths of community-based primary care services, the improved importance of health surveillance and health promotion, and probably invest in more increasing the quality and quantity of health workers on the front line, the primary care, even at the expense of investing in, for example, specialists for whom private returns may be available. And one more thing is that we know that some of the risk factors of NCD are really modifiable, right? I mean, there are behavioral and lifestyle risk factors that can be affected by policies. And because some of them actually involve externalities and market failures, it should be open to public intervention. And one of the examples that I think important to think about is the smoking, which is a major risk factor in NCDs. And smoking is behavioral, and it involves negative externalities as well as market failures. And we have a huge problem of smoking in Indonesia, out of 3 men in Indonesia smokes. But Indonesia is also one of the very few countries in the world that hasn't ratified WHO framework on tobacco control. So this seems to be an area in which we should push forward and have the opportunity to push forward, and we'll be able to make significant advances to manage the prevention side of the NCDs. But again, we all know this is a huge challenge given the conflicting interests among the important stakeholders. So there are probably many other examples like this.
Thank you, Firman. We might come back to some of those issues if we have time later on, but just moving on now to switching back to macro economic issues and coming to you, Steve. You mentioned earlier about how care needs to be put into the exit strategy for Bank Indonesia in terms of its financing of the government budget. We also, many people now worried about, as the Federal Reserve, I think Janet Yellen has now said something about interest rates may need to be higher now to contain inflation. I'm sure, I think that was a surprise to Jay Powell, but nonetheless, she said that. Raises the specter of taper, another sort of rerun of a taper tantrum for Indonesia, but possibly at a very difficult moment. So just, obviously there's a lot of moving variables, but, what are your thoughts on this idea of the exit strategy and navigating the process from here?
What Bank Indonesia has done would be called anywhere, it would be called unconventional monetary policy. And perhaps the most unconventional part of it was that Bank Indonesia agreed to fund some of the budget deficit. Now, there's a very sad history of central banks funding the budget deficit in Indonesia. Not that long ago, more or less just one generation ago, under President Sukarno. And so it will be very important that Bank Indonesia gets back to ordinary monetary policy. We don't want to leave the message that it's very easy to fund whatever budget deficit you like by just asking the central bank to fund it. So the question is how to make the exit. Now, it's very hard to talk about that. We didn't talk about it in our paper because you don't know the timing. You don't know when COVID is going to last, so you can't set a future date. So that's unfortunate. But you could set a kind of rule that says very clearly, this funding, this unconventional policy was very strictly tied to COVID, a major national crisis. It is not available for other things. When Indonesia gets on top of COVID, which it will, we, Bank Indonesia, will definitely want to get back to normality where the central bank does not fund the budget deficit. That's, I think, the main message that comes out of our paper, looking at it now 6 months later.
Thank you, Steve. Ibu Masyita, I'll turn to you now. I mean, you could respond to many of the things that have been said because they all have some bearing on fiscal policy and the government's reform agenda. But I'll just sort of put the question to you. I mean, what do you think the priorities should be for fiscal policy from here in terms of enabling Indonesia's economic recovery?
Thanks, Roland. So the major priority of fiscal policy is basically is on 3 areas. Yeah. First, the most important thing is domestic revenue mobilization. This is important because we need to improve tax ratio, which is still below peers, to be able to grow above the potential. Otherwise, fiscal cannot support growth if we let tax ratio is at current level. Yeah. And if you compare Indonesia and emerging market peer, for example, the tax rate is quite high, but the effective tax rate, because of these incentives and a lot of leakage out of the tax system, create the lower effective tax rate compared to peers. So this is not a very ideal condition that we need to improve continuously. Indonesia have done the fuel subsidy reform, but we need to still do a lot of things because, as you know, the rigidity of the price mechanism has created a compensation similar to subsidy that has to be reformed. Otherwise, spending can go to areas that are not really supporting growth or social safety net. On the spending reform, we also improve, data to make sure that social safety net can go really to the bottom 40% that's needed. Number 3 is to improve the below the line risk. Yeah, you know that Indonesia have below the lines transfers to these SOEs and stuff. We have a massive SOE systems that is currently is being reformed. One is to go back to the essence of having an SOE is to provide public goods. So only focus on area where market cannot provide the goods optimally. Yeah, but the area in which the market system can provide goods or service more optimally, then you do not need to have an SOE on that particular area. On the SOE reform, we also do a lot of stuff. For example, we create the Sovereign Wealth Fund, for example. This is another type of entity which will invite foreign investors, but a bit different legal setup with the SOE. Because this is independent, directly reported to the president, and only acquire asset that is really commercial. So it's a commercial basis, while the SOE will still have the so-called penugasan. So like serving public goods, even though it's not profitable, to serve the publics.
Thank you, Masyita. Can I ask one follow-up question then? I mean, just in terms of the overall fiscal strategy, I mean, obviously the recovery process for the economy is still quite uncertain. A lot of bumps in the road. We're not sure how it's going to go. But just, how do you think about the need for, balancing the need for consolidation and ultimately sustainability versus the need for, providing support to the economy through what could be actually a longish recovery process? How do you think of the balance between these?
Yeah, we need to strike.
Please.
Yeah. So we need to strike a very difficult balance, between, solving the current issues, which is in the short run, and also we also still want to do reform, which will improve growth. So it's for medium or long term. Yeah. Unfortunately for the government, there's no such trade-off. You still have to do both, right? The issue is how to maintain the fiscal posture so you can still do the short-run needs, for example, like vaccine and, the social safety net expansion and all of the other stuff to survive the recession. But also you cannot leave the long-term issues behind because it will eat the economy out eventually, right? Because Indonesia aspires to be an advanced economy by the 100th years of independence. So now the government is trying, but in the middle, you have wallet size and financing issues, right? Because many countries are experiencing credit downgrades, yields are going higher. So the cost of debt service is growing higher and higher, especially if you compare to the revenue, which is why we will do domestic revenue mobilization even more. So these are all the things that we need to put together at the same time. We cannot choose between the two. You just choose the magnitude and intensity. So last year, the intensity was more towards the short run. This year, it's more balanced towards short and long term sustainability. And then hopefully next year, if pandemic is over, then we can push reform even more.
Thank you, Masyita. Very, very difficult balancing act for all countries, but especially in a place like Indonesia where options are inherently constrained. We might sort of move now to the Q&A with the audience. We have a few questions come through, but let me just say for anyone that would like to ask questions, remind you can put it into the Q&A box at the bottom of the Zoom application, or you can also use the raise hand button. And I'll try and come to you by spot it on the system. But first, just to kick things off, we'll start with a relatively easy but important question, which was put to Professor Bessell. Just asking if you could explain further about multi-dimensional, poverty, what it is, particularly, I suppose, in the Indonesian context. Does Indonesia have enough data to make this a useful concept? And then a second question, asking you about particular food security. You did mention it, but food security and hunger. What's been happening with that? The questioner, Mei-Ling Oi, Gardner from Universitas Indonesia, notes that there's a lot of expectation that there'll be serious food security issues and hunger issues as a result of the pandemic, early in the pandemic. I must say I thought that as well. And then you don't hear a lot about that since the early part of the pandemic. So they're wondering, can you share any insights as what's been happening with that?
Sure. Thanks, Roland. Can I just check? I'm having a little bit of trouble hearing. Can people hear me okay?
Yes, you sound very good on my
Great. Okay. So there have been studies of multidimensional poverty in Indonesia, both through the work that we've done with the individual measure of multidimensional poverty in South Sulawesi, but that didn't rely on existing data. And so it's a really good point in terms of the question that required us to collect data to be able to populate that measure. There's also been work done around the Multidimensional Poverty Index in Indonesia, and that is based on existing data, and so that can be measured across 3 dimensions of health, education and living standards. The official poverty line, of course, is not multidimensional. It's based on consumption expenditure. If I could just perhaps explain what the definition is and why that matters. So the work that's been done around multidimensional poverty globally, and particularly led by Oxford University and UNDP, makes the point that a person who is poor can suffer from multiple disadvantages at the same time. So they may have poor health, they may be suffering from malnutrition, they may not have clean water or electricity. And focusing on one factor alone, such as income, isn't enough to be able to capture the reality of poverty, but perhaps more importantly, it doesn't give us enough data on which to respond. And we've seen in our work that moving people marginally above an income poverty line or an expenditure poverty line may look like a great success. It may appear that we've moved a very large number of people. But if that movement has been driven by a very small increase in income, then we may have changed people's lives very little. And the kinds of things that they need to buy or to access in order to move out of poverty are still not attainable. In the work that we've done, we define multidimensional poverty as the interplay between material and key non-material dimensions that prevent an individual from participating in his or her society and living a life with dignity. And I've already talked a little bit about the social and relational dimensions of poverty, which may include having a voice in one's community, some control over personal decisions such as seeking work or education, and levels of dependency or ability to reciprocate. But we also, in our approach, measure dimensions such as sanitation, water and energy. And poverty may not be understood in terms of thinking about income alone, because sometimes, particularly in poor communities, access to those things are not only dependent on income. They're about much broader structural issues and infrastructural issues. So that, in a nutshell, is the way we define and approach multidimensional poverty. I think it would be possible on the data available, and it's been demonstrated on the 3 dimensions of the MPI, that multidimensional poverty can be assessed. The work that we've done has also demonstrated, but particularly in income-poor hotspots, it's possible to collect data that really enriches the way we understand and can respond to poverty. And so, there are necessarily trade-offs in a time of austerity about how much money should be put into data collection, but at least some dimensions of multidimensional poverty can be assessed. In terms of the question and the excellent question from Mei-Ling on food, on hunger, I'm afraid I don't know, and I feel here at a great distance from Indonesia, I'm not really sure what's happening on the ground around addressing hunger, and I haven't seen very much either, excepting for some emerging work, including some that was recently published in New Mandela, which was really presenting qualitative stories around food insecurity and hunger. If others know about this, that would be great to hear it, but I think it's an issue that's perhaps going under the radar.
Thank you, Sharon. I mean, it is something to note as researchers, the level of disconnect that COVID-19 creates and the ability to understand what's going on the ground and not just rely on things like data to try and guide us, but to try and understand in a soft sense what's happening is extremely difficult, and I think it does feed into how research is done and quantitative understanding. We have another question from Hans-Peter Witoelar to Firman, and they're asking about that they say that only 3 indicators of NCDs are in Indonesia's medium-term plan, and are only about stopping the prevalence of 2 NCDs related to hypertension and obesity, and not much on addressing the prevalence of youth smokers. So the question is essentially, does the government take NCDs seriously?
Yes, thank you. That's a great question. I think there's no question that the government is taking NCDs seriously, but as I discussed earlier, there are a lot of challenges, and there are some areas in which we see what seems to be a clear path to at least small advance is not happening, and one of that is on smoking, and I think it is. Youth smoking is really important because that's actually where a lot of the informal information externalities comes in, right? The people not being able to make good judgment on health behavior or risk behavior, and so preventing youth smoking should be a priority. And I think we already seen some. A lot of trade-off being made earlier this year, for example, during the pandemic, where the excise tax for tobacco has not increased as much as in the other years because of the pandemic. This is to support for example, the tobacco industry, basically. So, there are all these challenges, the conflicts of conflicting interests that we face moving forward, and it's always been the case.
Thank you, Firman. I want to go to the audience whether or not we have anyone else like to ask a question. Just use the raise hand function or type it into the Q&A box. We don't have anyone in the queue just yet, so please think of a question. Feel free to make it a hard question for the panelists. I have the luxury of saying so. I should also just note that unfortunately Ibu Masyita has had to leave early from this event to attend some work matters, so we won't be able to put the question to her, but we'll see who else we can put the questions to. We did have one, just looking at the questions now, we had one for Ibu Masyita, noting that from Richard Borsuk, just noting that it is difficult to, of course, to raise taxes in the current environment. I might just go to you, Steve, if that's all right, as the resident macro person on the panel now. Just a little bit of your thoughts. I thought it was an interesting point from Masyita that they're going to prioritize revenue mobilization, of course, while balancing that against the need for providing providing support to the economy during the recovery. process. I mean, do you have any thoughts on this kind of balance? How should the government think about getting the macro policy mix right and balancing that? When we have this very uncertain recovery process, we do have the situation where fiscal sustainability is still, an important concern, and the tax base is obviously extremely low anyway in general. So I desire to do something about that. How do you think about managing the overall macro policy mix over the next, say, 1 to 2 years?
I shouldn't take much time on this, Roland, because I've got no useful answer. I've just observed that for as long as I've been associated with Indonesia, which is many decades, people have noted the problem of collecting more taxes and have tried in various ways to do it, but have not succeeded in making much progress. When you look at the peer comparison, Indonesia really comes out very clearly as a very poor case on revenue collection. But what you do, I'm sorry, I'd just be taking people's time if I warbled on about what you could do, because I think you need to be closer to it than I am.
Steve, we have one question from the audience from Asi Alamuan, more directly on monetary policy, a specific question, just how long can Indonesia keep doing what it's doing in terms of monetary policy? Do you think
that certainly is a good question. I mean, if you judged from the success so far, you'd say, well, when you've got success, go on doing it. But I don't think that's the right answer, because I think there are endless wants, partly because the shortage of taxation revenue, that the budget could dream up many, many things that could be done. And we're fairly sure that if you go on funding these things from the central bank, sooner or later, you'll reach a limit and won't be able to do it anymore. I think the thing that maybe none of us understand fully is that I think what this does is distort the financial system, because the financial system, the banks in particular, are effectively funding the extra budget deficit that seems to come from Bank Indonesia. Now, if you put too much burden on the banks, then their profits are cut, they can't do their job, and the job of financial intermediation shifts away from the banks to people who aren't subject to this compulsory form of taxation. So I wish I had a better answer, but I think the short answer is it's better to stop this too early than to wait until you have a real problem with the central bank funding the deficit. So I get back to the point I made earlier. I think Bank Indonesia, in its quiet way, continuing its quiet dialogue, should be saying, yes, we did this because there was a national emergency and this is unconventional monetary policy. And as soon as COVID is over, whenever that is, we want to stop funding the deficit.
Thank you, Steve. Pandu, I might just turn back to you just to ask you about your views. You're a senior health specialist at the World Bank. I mean, talking about the economic, we're talking about the economic crisis here, but as everyone knows, health policy is economic policy in the current situation. So I'm not sure if you've done any specific work on this, but your views on vaccine rollout obviously is absolutely critical. What are some of the issues that you see for the Indonesian health system in being able to do something like this in the kind of speed that people are hoping for?
Okay. If I understand your question correctly, because I don't know why, but your voice is a bit faint. The impact of the, as I mentioned earlier, that it's stretched the the capacity of the existing health system to respond to the to provide care and treatment to the critical cases, but also to be able to trace and test and to find cases. So I think that has been what is called quite obvious in the beginning. The government has been trying to scale up the capacity to do the testing and especially tracing, especially outside of Jakarta, because these capacity are still mainly concentrated within major cities in Indonesia, right? So the pandemic also highlighted the issues of discrepancies of health system capacity across the country. It also highlighted the issue of the quality of care. Not only the number of health personnel, but also the capacity of health personnel. So it highlighted all of these issues, right? And as the pandemic is now seems to be prolonged, right? The capacity of the health system to continue detect and also to respond to the prolonged pandemic on the one hand, and on the other hand, to be able to ensure the sustainability or continuity of the essential health services. So it is really a double whammy for the health system. And so there have been strategies that brought up to address these issues. Number one is more responding to the immediate need to respond to the pandemic, scaling up the capacity and so on and so forth. But on the other hand is to ensure that the system will be able to continue providing these essential health services, especially those that have longer term impacts such as NCD. But again, there are a lot of elements that are already there, present, but I think the government needs to think about, as I mentioned, I brought up the issue about telemedicine because it is one of the government strategy, but it requires a system that support the implementation of that strategy, right? So in general, the strategy is there, but also the government needs to think about what are the things that are needed to support the implementation of this strategy. But there's another challenge I need to bring up here because, again, with the macroeconomic situation, it is expected that the government expenditure will be smaller for the next few years. So if the government is maintaining the existing share of government expenditure for health, that means that the amount of resources available for health will be smaller. So this is the opportunity for the health sector to mobilize resources to create pro-health taxes for tobacco, sugars, sweetened beverage, and other taxes that will have benefits also to health status. The other thing that needs to be think of is about debt swap or debt relief, because the increasing what's called mobilization funding from the external sources and the opportunity for the health sector to do this debt relief of that. So I will stop there. Over to you.
Thank you, Dr. Pandu. Might turn to, we have a raised hand from Professor Peter Waugh. So Peter should be off mute, taken off mute.
Okay, great. Can anybody hear me?
Yes, we can hear you.
Great. I have a two-part question. The first part is about the famous Sadli's Law, named after the Indonesian economist, Professor Sadli. Sadli's Law, as I understand it, said that good times produce bad policies in Indonesia, probably applies to other countries too, and bad times produce good policies. Well, if ever we had a bad time, this has got to be it. The worst time for Indonesia since the Asian financial crisis. So I wonder whether there's some scope for that actually to be true. We've been talking about the Indonesian budgetary situation, and we all know that there are some wasteful forms of public expenditure in Indonesia, including ongoing petroleum subsidies, which might be challenged in the aftermath of the pandemic, once the pandemic is over. Is there any scope for meaningful economic reform beneficial to come out of the crisis? So that's the first part of my question. And the second part, I want to put the two editors on the spot, Firman and Blaine, if they're both there. Unlike the rest of us, you've had a chance to read the book. I'm looking forward greatly to reading the book. I'm hoping to pick it up this afternoon and start my reading. But anyway, you've read it, and you would be able to tell us what are the biggest weaknesses in our knowledge of the pandemic, what its effects are, what can be done, the aftermath, that are revealed by the studies in the book. So that's a question for Firman and Blaine, if they're there.
Thank you, Peter. So Sadli's Law, good times, bad policy, bad times, good policy. Which of our panelists would like to have a crack at that? Can anyone see the offshoots for good policy? Sharon, can I throw you in the hot seat to share your thoughts? I mean, I'll put it a different way to make it more squarely related to your area. I mean, is the social protection response been as good as it could have been over the period so far?
Thanks, Roland. Thanks, Peter, I think, for that question. In terms of, and I might combine my response here to a response to one of the questions in the Q&A, which asked about multidimensional poverty and is it that the social safety nets have actually worked. So like Stephen, I'm going to preface this by saying I feel too much at a distance to really be able to answer this in an expert or comprehensive way. The research and modelling that I talked about that UNICEF has led does indicate that the social safety nets or the expansion of the social safety nets have prevented a large number of households from falling into poverty. And so that increase appears to have been good policy in terms of doubling or increasing substantially the amount of spending on social protection, extending eligibility for PKH. So that appears, based on that UNICEF work, to have been effective. And so we might say that was some good policy. I guess the other side of that is that those predictions are also saying that as those emergency measures are wound back, we are likely to see spikes in both poverty and vulnerability. That's perhaps a small example. But I think the pre-existing challenges that I mentioned earlier around targeting remain serious problems. And I guess the other thing that I would say that perhaps is not in response to Peter, but in response to the question in chat, is that in regards to poverty, we have to keep in mind that Indonesia's poverty line is widely recognised as being very, very low. And so when we observe that perhaps increases in poverty weren't as high as we'd expected, we have to remember how low that poverty line is, and also recognise that there appear to have been large numbers of people who are now highly vulnerable and have moved closer to that poverty line. I don't think that does justice to Peter's question, but some suggestions.
Thanks, Sharon. Steve, do you want to come in there?
The one thing that I recall about Sadley's rule is that it takes on political problems. The economics is not the answer. It says there are moments when you can take on the politics. I'm too far away to make many suggestions, but I can't resist just a couple. I heard about the smoking one. This just seems one of those cases where what we call a sin tax, in other words, tax on something that you don't want to happen anyway, that you're happy to see as a nation, you're happy to see the tax actually reduce consumption of it. This would have to be the standout one. As Indonesia, I wrote a blog on this some years ago, at that stage certainly, Indonesian men led the world as being the world's greatest smokers. And I think of that truly frightening story that appeared on TV around the world of the 4-year-old, I think he was a 4-year-old, who was a chain smoker. Now, this would be the moment to take on the politics there. Very difficult. The other one, and it was mentioned before, is the state-owned enterprises. One senses that there may be a moment and a way of getting at this, but clearly it's, again, another political problem, which, when times are grim, you may be able to take on these political problems and beat them.
Thank you, Steve. I just note there's, before we might close on the final question to Firman and Blaine on the lessons from the book, but just one last question to you, Steve, in the chat from from Compass, just asking what will happen to the financial sector in Indonesia when inflation is high in the United States and Fed begins to raise rates? Will there be another massive outflow, and can Indonesia manage that situation and at what cost? So a taper tantrum rerun, see that as a big risk.
Well, Indonesia in 2013 was included in the Fragile Five. In other words, some great expert from one of the leading banks had identified Indonesia as the one that was going to get into most trouble. Indonesia actually came through 2013 reasonably well, came through 2015 where there was some problems at the beginning in China reasonably well, 2018 when again there was an outflow due to America tightening its interest rate. And remarkably, in March last year, in the early stages of the COVID, again, people were suggesting doom and gloom for Indonesia. And there was a little bump, but it actually came through well. So 2 points to make. Of course, I'm an optimist in saying that that will continue, but they have done okay so far. So you'd have to say it's still a risk, and that's all the more reason for the authorities, particularly in Bank Indonesia and the Ministry of Finance, going on being very careful. But I think there's a very good chance that Indonesia has moved out of being in the Fragile Five, and it will come through this quite well.
Thanks, Steve. Good to have a positive note on that issue. I might let us finish off on the second part of Peter's question to Firman and Blaine, if you want to jump in. It was about what are we seeing in terms of our understanding of COVID.
Yeah, so let me start first, and then Blaine, you jump in. I'm writing this paper, and you know, for last year in the middle of start in the middle of last year, and all of the authors experienced the same thing, which is there's really little thing that we know about COVID, and there's also little that we know about any information about the government responses. And I think one takeaway from reading the book, and you can see that one of the big issue is something a lack of coherent message in the part of the responses, but partly also based on just the unavailable information for everyone involved of the stakeholders, and that's also true for us as the authors trying to make sense of data that we have at that point. But look, moving forward, and I think some of these issues are still there in terms of the mixed messages, and you can. And this is not only in our chapter, but I think it's in all our chapters. In, for example, in the chapters by Arianto on trade and food policy, and on Chris, and there's really a lot of uncertainties about what the government's intention and the messages that that's being put forward. Blaine, maybe.
Yeah, sure. Can you hear me okay?
Yeah.
Okay. I get a little bit worried every time I see Peter Ward's hands go up to ask a question, because I know for sure it's going to be an impossible one to answer. So thanks again for that, Peter. Always appreciate it. I would make two comments. One on Sadli's law. I think another one that we might keep in mind has to do with the reform, quote unquote, of intergovernmental fiscal relations in this context. That government cut transfers to regions by about 8% or so. We're not quite sure of the final number, but around that. And my understanding is that government may try to keep that downturn in revenues more or less permanent, or at least use the occasion as a means of keeping transfers lower than they might otherwise be. I should hesitate to say that it's not a fact. I don't know for sure. It's just a rumor at this stage, but let's keep that in mind. On the second question about the data, I mean, I think Firman is right. It was very challenging to write chapters for this book and to edit the book. Essentially, there were two problems. One is that we had a lack of information about some very key variables, the number of COVID-19 cases, for example, and the number of deaths. I mean, Budi did a very nice job in his chapter trying to estimate what the real caseload was like and what the real deaths were like, and showed pretty convincingly, I thought, that the real numbers were 2 to 3 to 4 to 5 times larger than those that were being reported. So when you don't have information on some key variables like that, it makes the analysis quite challenging. And even on some of the other information on which we did have data, I mean, those variables were essentially moving targets as well, right? So we didn't really know what was going to happen to economic growth. We didn't really know with any certainty what was going to happen to the LPBN, the budget, or household spending, for example, right? So we had some information on those, but those things kept moving all over the place. And at some point we just had to say, okay, we're gonna cut bait now, and we're going to go with what we had. And that's really the best that you can do under these circumstances. So what we'll do now is just track what the outcomes were really like, and see the extent to which we were accurate or reasonably accurate. And well, we hope that we were, but we won't know for sure. Anyway, thanks for the question, Peter.
Thank you, Blaine. And I think with that, we'll bring today's launch event to a close. Let me thank everyone for attending, in particular all of our panelists for your participation in the book launch, and wish everyone a good afternoon. Thank you very much.
Thank you.
Thank you. Good job, Roland. Bye.
Thanks, everyone. Would others like to have a group photo?
Sure, why not?
If you want to turn on your video. Is anybody else here?
Joe and Pak Chris, maybe good.
Apologies to Sharon.
Okay. Okay, thank you.
Anyone else want to come? Do you have a gini dong promosi? Anybody else want to turn on their video? I think Pipa, you want to come on, Pipa? Okay, I'll take one picture. If anybody else turn up. Thanks everyone, I got it. Thank you.